Dear friends, dear doctors, good morning everyone. Dr.MedEx Indian Medical Society will help you free of cost now. Dear FMG aspirants, जरूर देखो पास होने का राज. Dr. MedEx MCQ for FMG is going to help you. Dear candidates, जो लोग FMG में 125 से 149 वाले कैंडिडेट हैं, कई कैंडिडेट कड़ी मेहनत करने के बावजूद भी 125 से 149 पर रह जाते हैं, तो आप कड़ी से कड़ी मेहनत करें. हर सफलता एक नया सबक सिखाता है. मेरे FMG योद्धाओं, स्मार्ट स्ट्रेटजी से 150 पार करो, तुम्हारी मेहनत बेकार नहीं जाएगी. डॉक्टर जायसवाल का खास सवाल से सही दिशा मिलेगी. सबके सपने पूरे होंगे, हार मत मानो. नीट PG एस्पिरेंट्स के लिए कुछ खास सवाल और ख़ास बातें. नीट PG की रेस लंबी है, लेकिन धैर्य और फोकस से गोल हासिल करो. एक अच्छा रैंक तुम्हारा इंतज़ार कर रहा है. नीट PG टॉपर बनने का सपना का सफ़र आज से तेज करो. लास्ट बट नॉट द लीस्ट, डॉक्टर जायसवाल का खास सवाल अच्छी तरह से बार बार पढ़ो. ये सब के सब कुछ खास सवाल हैं जो बहुत रोचक और कॉन्सेप्ट बेस्ड हैं. मेरे प्यारे दोस्तों, आप लोग बहुत कड़ी मेहनत करते हैं, उसके बावजूद भी अपना मंजिल मुकाम नहीं पा पाते हैं. बहुत सारे विद्यार्थी जो इकोनॉमिकल क्राइसिस से जूझते रहते हैं, उनको मेरा सजेशन, आप कृपया अपनी मेहनत को बढ़ा दें और इस क्वेश्चंस को आप कॉन्सेप्चुअल क्वेश्चन समझकर पढ़ें, ना कि सेम क्वेश्चन कोई एग्ज़ाम में आने जा रहा है, लेकिन कंसेप्ट यहीं रहेगा और इसी पे बेस्ड कंसेप्ट पे MCQ एग्ज़ाम आएंगे, MCQ क्वेश्चंस आएंगे. सो इस कंसेप्ट को स्टेप बाय स्टेप हम लोग देखेंगे. तो आइए हम लोग कुछ देखते हैं. Cardiology, going to start the cardiology. This cardiology is a part of the medicine. The art of medicine has its link in the mind. So first of all, you make your mind confident, brave, intelligent. तब आप हर चीज़ को अच्छी तरह समझ पाएंगे. कृपया आप उतावला में न रहें, परेशान न हो. बार बार छोटे छोटे स्मॉल स्ट्रेटजी बनाकर शॉर्टकट से निकलने का रास्ता ना चुनें. एक बार मेहनत करें, जमकर मेहनत करें. मुझे पता है कि आप कामयाब हो जाएंगे. तो आइए हम अपने क्वेश्चन पे फोकस करें. क्वेश्चन नंबर 1. A 62-year-old man, that man has coronary artery disease, syncope, presents with syncope. All his physical examinations are normal, but this patient had bradycardia. That is, the heartbeat is going down, 56 beats per minute, and also irregular pulse. The ECG shows Wenchback type atrioventricular AV block. Which of the following are you most likely to see on the ECG? Option A, progressive PR shortening, progressive lengthening of the PR interval, tachycardia, or dropped beat after PR lengthening. So, हम इसको आपको बहुत अच्छा से ECG के मार्फत से समझाते हैं. आप कृपया ध्यान दें. Wenchback or type 1 second degree AV block is characterized by on the ECG by progressive lengthening of PR interval until a non-conducted P wave. The magnitude of PR lengthening declines with each beat, so the PR interval characteristically shortens before the drop beat. It is almost always caused by abnormal conduction across AV node. The QR complex is usually of normal duration. So इस फिगर से हम क्या देखेंगे? सेकेंड डिग्री हर्ट ब्लॉक टाइप 1, progressively prolonging of PR interval. So we are going to focus on only on PR interval. You can see from here, if you see the first PR interval of the PQRST, of the second PR interval of the PQRST, of the third PR interval of the PQRST, you can find variations by yourself. Now I'm not going to help you. You can see from this ECG here the length of the PR interval, you can see by yourself. You are smart, you are a doctor, so you can try your best to find out the basic clue. We are not going very high-fi. We have to find a basic clue. Here, after P wave, drop beat what? QRST, dropped beat, okay? Dropped beat of, so this is not going to be here. Non-conducted P wave. Non-conducted because after this is not going to continue, okay? P wave and QR complexes are normal, but PR interval progressively lengthen. This PR interval is going to become more and more. Drop beat. This means this drop beat, non-conducted P wave, leads to grouped beating. The block is almost always within the AV node. So I'm going to present you the another image ECG graph of the Morris type 1. Progressive lengthening of the PR interval followed by absent QRS complex, means absent QRS complex. Here you can see by yourself, here interval, okay? So P wave is here, but no QRS complex, means drop beat. This is drop beat, okay? Again, after that PR interval here, PQRST is here, okay, but you can see by yourself. So it's my request to see the PR lengthening is increasing in each complexes, okay? Again, I'm going to show you the another ECG. Here, second degree heart block, Morris type 1 benchmark. You can see from here. I hope you are understanding all this, and here the ECG reading itself explaining when we are going to focus on the small squares. So here the 4 smaller squares, here the 6 smaller squares, and here 7 smaller squares. It means you can judge by yourself that PR lengthening is present here, okay? And here again no QRS complex, okay? So now come to the question. And read the question again. A 62-year-old man with coronary heart disease presents with a pre-syncope. His physical examination is normal except for the bradycardia and the irregular pulse. The ECG shows Wenchback type atrioventricular block. Which of the following are you most likely to see on the ECG? This is progressive PR lengthening, progressive lengthening of the PR interval, tachycardia, and here is the answer. Okay, here is the answer. Dropped bit PR lengthening. Okay, come to the another question. Okay, another question second. Okay, normal question second. normal individual underwent evaluation of cardiac tissue. That patient is going under the evaluation of cardiac tissue. It might be possible that there is some disease. Which isoform of lactate dehydrogenase, that means LDH, is predominant in the cardiac tissue? Here, this patient have some issues in the heart. That is why doctor asks for the evaluation of the LDH. So, in this question, there are four: LDH1, LDH2, LDH3, LDH4. Okay, so I'm going to tell you. LDH1 is present in cardiac muscle and RBC. LDH1 is present in cardiac muscle and RBC. LDH2 is present in reticuloendothelial systems and WBC. LDH3 is present in lungs, and LDH4 is present in liver and skeletal muscle. Liver and skeletal muscle. Okay. LH4 is present in liver and skeletal muscle. Okay. So from this question, LDH1 is the answer. It means LDH1 is present in the cardiac tissue. Okay. Now we have question 3. Okay. Question 3. As you know that Framingham heart study is an example of. Okay. Framingham heart study is an example of. So I'm going to show you Framingham heart study. No, where is the picture? Okay, no problem. Let it be there. No problem at all. Framingham heart study. Let's join under, yeah, Framingham heart study. So this question number 3, Framingham heart study or Framingham risk score, it estimates an individual's 10-year risk of developing CVD, cardiovascular disease, initially focusing on the CHD, like heart attack. Updating all these informations, it now includes stroke, heart failure, peripheral artery disease. Point 2, points are assigned by age group. Points are assigned by age groups. Okay, points are assigned by age groups. And factor severity and factor severity total converts to percentage, and we can give it as in percentage. Okay, so there are 3 actually. Low means less than 10%. Okay, low means less than 10%. Intermediate, okay, intermediate means 10 to 19%. Third is greater than or equal to 20%. Okay, so here the applicant's clinician to FR is to guide prevention. Example, statin for high risk patients, and it's integrated into guidelines like ATP3. ATP3 stands for Adult Treatment Panel 3, the third set of evidence-based guidelines from the National Cholesterol Education Program NCEP. Number 5. Online calculators simplify it, but it performs best in white population aged 30 to 74. So main risk factor for Framingham risk score is, so risk factor, okay, risk factors, Yeah, risk factors present here. So age, sex, LDL, HDL, okay, cholesterol, diabetes mellitus, smoking. Okay, also include BP. Okay, also BP. Okay, whether the patient is treated or not for his or her hypertension. Okay, so come to the point. Okay, and there is one another let me explain it. There is one another important point is that Framingham diagnostic criteria. Okay, Framingham diagnostic criteria based on major criteria and minor criteria. Okay, so major and minor criteria. In major criteria, in this, and in minor criteria. So in major criteria, acute pulmonary edema, cardiomegaly, hepatojugular reflex, neck vein distension, PND, or orthopnea, RELS, and S3 gallop. Okay, and in minor criteria, hepatomegaly. In minor criteria, hepatomegaly, edema. Okay, edema, dyspnea on exertion, nocturnal cough, pleural effusion, or tachycardia. Okay, so these are some few important points about Framingham heart study. Okay, so what is the best answer? Framingham heart study is example of prospective cohort. Okay, I hope it's clear to you. Come to the another question 4. Carotid sinus massage leads to reflex bradycardia. Carotid sinus massage leads to reflex bradycardia. I will tell you later, explain you. Dancing carotids. First of all, let me explain this question. Dancing carotids. Answer is thyrotoxicosis. Which of the following is associated with the rheumatic heart disease? So the answer is McCollum plaques. Okay, I will explain you one by one. Yeah, I will explain you one by one. Yeah. Reflex bradycardia. It is a bradycardia. It means heart rate is going to decrease in response to the baroreceptor reflex, one of the body's homeostatic mechanism for preventing abnormal increases in BP. Second point, in the presence of high mean arterial pressure, the baroreceptor reflex produces a reflex bradycardia as a method of decreasing blood pressure by decreasing cardiac output. So, I will tell you few important points. That is MAP. What is MAP? MAP. Okay. MAP at resting heart rate. MAP at resting heart rate. What is the formula? 2 by 3 diastolic blood pressure plus 1 by 3 systolic blood pressure. Okay. Another MAP formula is, this is also at resting heart rate. Okay. This will also come in the exam. Diastolic blood pressure plus 1/3 pulse pressure. Okay. So another I'm going to explain you. Okay. So blood pressure is determined by cardiac output. Blood pressure is determined by cardiac output and total peripheral resistance, that is TPR, are represented by the formula blood pressure. Wait a minute. Blood pressure, BP, that is blood pressure, CO into TPR. Okay. CO into TPR, number 4 point. Okay. Cardiac output. Cardiac output is affected by cardiac output is affected by two factors. Number one, heart rate. And number two, stroke volume. And here I tell you the cardiac output. What is the normal cardiac output? That is 5 liter per minute. Okay. The cardiac output, the formula of cardiac output is equal to stroke volume into heart rate, or BP equal to cardiac output into total peripheral resistance. Okay. This was the point number one. This is point number two. Therefore, BP, blood pressure, equal to systolic volume into heart rate into total peripheral resistance. Okay. Okay. I will tell you one another point again. Yeah, I will tell you another point is that cardiac output equal to Q equal to systolic volume into heart rate. Okay. Another point is that Fick's law, Fick's principle. Okay, Fick's principle. What is the Fick's principle? Cardiac output equal to rate of O2 consumption by arterial O2 content, minus venous O2 content. Okay. So we can tell the formula is that CO equal to BO2 by CaO2 minus CvO2. Okay. So this is the formula. Okay. So from here you can get more information. Yeah, cardiac sinus massage leads to reflux bradycardia. Question 5. Question 4, it's okay. Question 5, dancing carotid is seen in thyrotoxicosis. We will move to another question. Which of the following is associated with the rheumatic heart disease? That is McCallum plaques. I will explain you about the Roth spots and Koplik spots, pulsus paradoxus. Okay. So another point. Yeah. In questions, you can see this is the measles or Koplik spots. Okay. Measles or Koplik spots you can find from here. These pictures. I will tell you on important points. You will get this information again and again. This is very important points. You should know the border of the heart. This is the heart. Okay. So this is the inferior border. This is apex. Inferior border. This is the left border. This is the right border, and this is the superior border. This is the superior border. Okay. So you got the point. Inferior border, left border, from your right hand side, left border, and from your left hand side, right border. Okay. Okay. On another point, we got in this question is that McCallum plaques. This is the McCallum plaques. Okay. This is the McCallum plaques you can find. I will explain you another important point of the heart, that this is the SA node, this is the AV node, this is the right bundle branch, this is the left bundle branch, these are the Purkinje fibers. This middle one is the bundle of His. This 1, 2, 3 is the internodal pathway, and this one is the intra-arterial pathway. So this side is the left bundle branch and Purkinje fibers. Okay. Come to the another question. Very important. Another question is that question number 7. Okay. Question number 7. Question number 7. Okay. So what is the question number 7? The most common site of innocent murmur. Most common site of innocent murmur is left lower external border. Still's murmur is by far and away by the most common innocent murmur. These signs are unreliable in those under the age of 1 year due to the higher incidence of congenital heart disease. Just now I told you another question, that impulses, electrical impulses originates, question 8. So electrical impulses originates from the SA node, as I explained you before. Question 9. Preferred biochemical markers present in the patients of the myocardial infarctions. That is the myoglobin, cardiac specific troponins, CKMB, and all of the above. So answer will be cardiac specific markers or troponins. This is the markers. Question number 10. Question number 10. This question, the drug aspirin. Here we are going to consider this drug aspirin has been used secondary prevention for ischemic heart disease because it inhibits TXA2 synthesis by platelets. That is, endothelium derived relaxing factors EDRF is unstable chemical substances released from vascular endothelial cells which line the inner surface of the blood vessels. Endothelial derived relaxing factor, that is EDRF, relaxes vascular smooth muscles, vasodilation, and inhibits platelet clumping, that is aggregation, and adherence to the vascular endothelial surface. So, question 10, the answer is inhibits TXA2 synthesis by platelets. Not the B inhibits prostacyclin synthesis. Like C inhibits the release of the EDRF. D inhibits the synthesis of the endothelium. Okay. Question 11. And we can get few important information from the question number 10. Aspirin produces its effect by inhibiting thromboxane A2, that is TXA2 production. Aspirin causes several different effects in the body, mainly number 1, reduction of the inflammation. Number 2, analgesia, that is relief of pain. Number 3, prevention of clotting. Number 4, reduction of fever. Okay. Due to decreased production of the prostaglandins and the TXA2, aspirin's ability to suppress the production of the prostaglandins and thromboxanes is due to its irreversible inactivation of the cyclooxygenase UX enzyme. Cyclooxygenase is required for the production and thromboxane synthesis. Come to the question number 11. Pediatric patient was prescribed erythromycin for the prevention of the recurrent rheumatic fever in the OPD for the PHC hospital. The pediatric patient has had a history of constipation, which medication should be avoided to prevent the development of any arrhythmia. So the answer of the question 11 is cisapride. Okay. Erythromycin. We should get information about erythromycin. Erythromycin, it can be given intravenously by mouth. The use of erythromycin ETM is for the treatment of the several bacterial infection. We are going to get few important information about the erythromycin. Number 1, erythromycin help in the respiratory tract infections. Erythromycin help in the skin infections. Number 3, chlamydia infections. Number 4, PID. Number 5, syphilis. Number 6, to prevent the group B streptococcal infection in the newborn during the pregnancy and to improve delayed stomach emptying. Number 7, an eye ointment is routinely recommended after delivery to prevent eye infection in the newborn. Common side effect of the erythromycin: abdominal cramps, vomiting, diarrhea. More serious side effects of the erythromycin: Clostridium difficile colitis, liver problems, prolonged QT, allergic reactions. Erythromycin safe it is generally safe for those who are allergic to penicillin, safe to those who use its use during the pregnancy, safe during breastfeeding. Note, its use by the mother during the first 2 weeks of life may increase the risk of pyloric stenosis in the baby. What is Avastin? Given in the option C. A second generation antihistamine used primarily to treat allergic conditions like rhinitis and urticaria. Another important points about the cisapride: is used for the treatment of GERD, gastroparesis, and constipations. It was prescribed for heartburn, indigestion, IBD, IBS, irritable bowel syndrome, and motility disorder by enhancing the gut movement. Today I am going to leave here. I hope सबको अच्छा लगा होगा. अगर आपको अच्छा लगा होगा तो आप ज़्यादा से ज़्यादा अपने दोस्तों को शेयर करें, लाइक करें, कमेंट करें, फीडबैक दें. ये मेरी इच्छा है कि मैं इसको ज़्यादा से ज़्यादा इम्प्रूव करूं और सब स्टूडेंट्स को ज़्यादा से ज़्यादा बेनिफिट्स मिल सके. थैंक यू वेरी मच.